Hey everybody, how to know it's not plantar fasciitis. It's really important with plantar fasciitis that we get a correct diagnosis, because a lot of the time there's quite a few differential diagnoses that are actually playing a big part. And I talk about this as like a plantar heel pain syndrome now, where I'm moving away from plantar fasciitis and I'm either calling it plantar fasciopathy, a condition of the plantar fascia, but more appropriately a plantar heel pain syndrome. And this takes in a few different diagnoses that I've got here. And really start thinking about this as, okay, a plantar heel pain syndrome could be the plantar heel spur, could be the plantar fasciitis, it could be the Baxter's nerve entrapment, and there could be some fat pad inflammation or atrophy occurring there that are all sort of bringing together this combination of concerns that we call plantar heel pain syndrome. And if I can't say anything else, that's all I would say, because it's really important to understand a little bit more about when it's plantar fasciitis and we can just treat the plantar fascia, or when it's a number of these different things. Thankfully, a lot of our treatments can help more broadly with this, but depending on the condition, we might need to put a few more different interventions into place, potentially injection therapies sooner. Plantar heel spur. It's going to be there, and demystifying sort of the public perception of when they come in and they got heel pain, they say, I have a heel spur and it's a real problem and that's why I've got pain. It's about saying, okay, there may be a heel spur there may not, but really we want to be saying that that's not where your pain's coming from. It's not the heel spur, it's that plantar fascia that's really tight. In the case that there is a heel spur, having a look at the size and the direction of where it's going is important. If it's a little bit more plantarly directed, then that's where it can be causing some concerns. There may be previous fractures of that area even, but typically it's really well encased within sort of the soft tissue structures underneath our heel and is unlikely to be causing a significant concern unless it's quite large. When it is quite large and it is causing concerns, on MRI we might be seeing some bone edema, and that could be causing some of the pain that our patients are experiencing. But then when we move on to some other conditions that could be causing further concerns here, we start talking about sort of nerve entrapments, and we start looking at tarsal tunnel syndrome and whether there might be a space occupying lesion such as a ganglion or a lipoma. There could be a distally extending flexor hallucis longus muscle belly, which I've seen previously. There's quite a few different things that could be causing this tarsal tunnel syndrome, and treating those appropriately is really important. A lot of the time we can get an indication of whether this is tarsal tunnel syndrome by just doing a really quick Tinel's percussion of that tarsal tunnel as it's coming around the medial aspect of our rear foot, and seeing if patients have any tingling, sharp shooting, pins and needles or numbness associated with that area. And if these are positive, then it's likely that there could be a tarsal tunnel syndrome or concern that's also causing some peripheral symptoms into that plantar heel. When we look to that Baxter's nerve entrapment, a little bit more inferior from that tarsal tunnel, as it's wrapping forward of the calcaneal tubercle. Again, if we're doing a Tinel's percussion and getting those neural symptoms, that can be quite diagnostic. There may also be some atrophy of our muscles around that abductor digiti minimi, and that's where we potentially could be finding that that Baxter's nerve is entrapped and causing some of the pain that we're seeing. Similarly, that's all a part of that plantar heel pain syndrome. When we start looking into that plantar heel, really getting an indication of whether it's on that plantar fascia about 0.5 centimetre to 1 centimetre off that medial tubercle, or whether it's in that central plantar heel, where there could be some fat pad inflammation, or even some fat pad atrophy if there's been several corticosteroid injections. And that's all going to play into what's happening and how we're going to be approaching this. And this is one of the reasons that I'll typically not give any more than 2 to 3 steroid injections of the plantar heel, because I'm really concerned that longer term, if we have several steroid injections, we're going to be dissolving the fat that's in that heel and potentially causing further concerns in the future once we potentially resolve that plantar fasciitis, if it even does. And so ensuring that we have the right diagnosis and treatment for plantar fasciitis is incredibly important. Now, of course, some patients will come through and they'll say, oh, I've got Achilles tendinopathy, my heel hurts, and this is something that I'm always like, okay, great. Then I go to push on the back of the foot where the Achilles inserts onto the calcaneus, and that's not where the pain is. And so, you know, making sure you're very specific and always palpating to make sure you know where the pain is, whether it's posterior or plantar, is going to get you away from the trap of someone coming in saying, oh, I've looked at Google, I typed in heel pain, the Achilles tendon somewhat where my pain is, and therefore it must be that. Really easy one to tell, and so I'm not going to go on about that because there's quite a few different aspects of that plantar heel pain syndrome that I want you to have a bit of a think about and start incorporating some of the assessments that I've spoken about into your clinical day as well when you see someone that comes through with heel pain. But for the meantime, feel free to subscribe, have a look at some of our other videos, write any comments. I'd love to hear a bit more about what you think about that plantar heel pain syndrome, and we'll see you in the next video. Cheers.